Has your doctor discussed with you about type 2 diabetes? Have you been diagnosed with the disease? The good news is that type 2 diabetes can be reversed, especially when it is treated early. This is because the pancreas produces insulin. The longer the delay in treatment, your insulin resistance can cause more damage to your pancreas, and the less likely your pancreas will recover. Moreover, if diabetes is not treated early, the persistent high level of blood sugar levels would inevitably cause life-threatening health problems. Today, we will share with you the different methods to treat type 2 diabetes. What are some of the natural remedies, and what are the types of medications that are normally prescribed by your doctor? Make sure you watch till the end so that you have an overall picture on his treatments. You'll need them to work together to be effective. Subscribe to the channel and leave a comment saying "I subscribe," or provide any suggestions on videos that you're looking for on weight loss, health improvement, or muscle building, and we will respond to your comment. Don't forget to turn on the notification so that you don't miss our videos. Now, let's get straight into the video. Let's start with the natural treatment methods. We will touch on the different types of medication in the later part of the video. Number 1. Healthy diet. Unlike the perception from most people, there is actually no specific diet for diabetes. However, there are certain guidelines. The key to success is to eat a variety of healthy foods. The different groups include fruits such as berries, melon, oranges, apples, and grapes. Non-starchy vegetables like carrots, tomatoes, broccoli, leafy greens, and peppers. Whole grains, and these include quinoa, oats, barley, wheat, and brown rice. You can obtain your protein from fish, lean meat, chicken, beans, tofu, milk, yogurt, and cheese. Avoid animal fat where possible. Monitor the amount of carbohydrates and calories intake. This is to keep your blood sugar level stable and within the acceptable range. You can consume healthy fat from food sources such as avocado, olive and canola oil, nuts and seeds, fatty fish including salmon, mackerel, and tuna. Use healthy cooking oil like canola and olive. Avoid the use of oil from butter, lard, or margarine. So, what are the foods and drinks that you should limit? Avoid sweets, candy, ice cream, and desserts. Foods that are high in salt content should be reduced. Fried foods that are high in saturated and trans fat are unhealthy for you. Sugary beverages like soda, sports and energy drinks should be avoided. Drink water rather than sweetened beverages. If you have to consume alcohol, do so in moderation with no more than 1 drink per day. If you are on medication, consuming alcohol can cause your blood sugar level to drop. This is particularly the case when you drink alcohol on an empty stomach. It is best to have some food before drinking any alcohol. How much food should you eat? Blood sugar level and body weight can be better managed if you have the right amount of food. There are 2 common ways to help you plan the amount of food that you should eat for each meal. One is the plate method and the other is the carbohydrate counting method. The plate method is most suitable for lunch and dinner. It helps you work out the right portion size without the need to count calories. Use a plate that is about 9 inches. Fill half of it with non-starchy vegetables. 1/4 is for meat and the other quarter is for grain or starchy vegetables. Starchy vegetables can include corn, beans, peas, and lentils. You can add some fruits to your meal. The carbohydrate counting method would require you to monitor the amount of carbohydrates intake per day. As carbohydrates are converted into glucose, this food source can affect blood sugar level in your body substantially. As a result, having a controlled level of carbohydrates intake can help you stabilize your blood sugar level. Carbohydrates counting is particularly important if you are using insulin. The amount of carbohydrates you eat affects the quantity of insulin you should take each day. When using carbohydrates counting method, you need to learn how to estimate the weight of carbohydrates in the food. Foods high in carbohydrates will normally come from starch, sweets, and fruits. Food labels with nutrition facts provide vital information on carbohydrates content. Once you determine the weight of carbohydrates for each food, add all the grams to derive the total carbohydrates you eat for each day. Best sources of carbohydrates include vegetables, fruits, bean, and whole grains. Avoid processed food such as sweets, white bread, and white rice. They contain much sugar that can cause your blood sugar level to increase dramatically. When should you eat? It is important to eat at about the same time each day, especially if you are on diabetes medication. Certain types of diabetes medicines or insulin can cause your blood sugar level to drop substantially when you skip or have a delay in taking your meal. Check with your doctor to see if the medicine you take requires you to have specific meal time each day. Number 2. Regular exercise. Exercise plays an important role to help you regulate your blood sugar level. You can have a combination of cardio and weight training exercises. There are many cardio exercises that you can engage in. They include walking, jogging, running, swimming, and cycling. Choose those that you enjoy doing. Aim for a minimum of 30 minutes of exercise each day, or at least 150 minutes per week. Weight training can increase your strength and balance. This will help you perform your daily activities easily. Weight training can include weightlifting and yoga. Try to have at least 2 to 3 weightlifting sessions each week. As you need your muscle to rest, it is better to have the training done on alternate days. Minimize inactivity such as working in front of a computer for too long. Go for a walk or some light-duty activity at an hourly interval. Such activity can help you control your blood sugar level. Number 3. Weight loss. If you are overweight, weight loss can help you better control your blood sugar level. You can see amazing results even when you have lost as little as 5% of your weight. The more weight you lose, the greater is the benefit to your health in managing diabetes. In addition, losing weight can also help to control blood pressure, cholesterol, and triglycerides. Number 4. Medication. If the target blood sugar level cannot be maintained through a combination of diet and exercise, your doctor may prescribe medications to lower your insulin levels. There are different types of medications, and the common ones include the following. Metformin. Metformin is normally the first medication prescribed to treat type 2 diabetes. It works by lowering the production of glucose and at the same time helping your body use insulin more effectively. It can cause some side effects such as nausea, diarrhea, and abdominal pain. Glynides. Glycine works by making your pancreas produce more insulin. It may result in low blood sugar level and weight gain. Sulfonylureas. It works by enabling your body to secrete more insulin. Low blood sugar level and gaining weight are some possible side effects. Including mimetics, they are injected to slow digestion and help to lower blood sugar levels. They also provide other health benefits such as weight loss and the improvement of your cardiovascular system. Nausea, diarrhea, and pancreatitis are some of the possible side effects. DPP-4 inhibitors, they help to reduce blood sugar levels. Some possible side effects are pancreatitis and joint pain. SGLT2 inhibitors, it helps the kidney to lower the blood sugar level. It may help to reduce the risk of heart and other cardiovascular diseases. However, the possible side effects include the risk of bone fractures, amputation, yeast infections at the vagina, and infection of the urinary tract. It can also cause low blood pressure and high cholesterol levels. Insulin therapy. It is normally prescribed at the later stage when the blood targets are not met by other medications. There are also different types of insulin. For example, the long-acting ones is meant to control your blood sugar level over a much longer period of time, such as 24 hours after administration, while the shorter-acting insulin could be used for mealtime as it only takes effect for a shorter period of time. Your doctor will prescribe the type of insulin that is suitable for you. The type and dosage may vary as time progresses depending on your blood sugar levels and its stability. Most types of insulin are administered through the form of injection. Side effects of the therapy could include low blood sugar levels and high triglycerides. In summary, a combination of healthy diet, regular exercises, weight loss, and certain medication can help to treat type 2 diabetes. The earlier you seek treatment, the more likely it can be reversed. Consult your doctor on the specific diet and medications that are most suitable for you. Watch the next video and the videos with links in the description below for effective and natural diets to have a breakthrough in weight loss. If you like this video, click the like button, subscribe and turn on the notifications so that you don't miss more videos on how to lose weight, improve health and build muscle. I will see you in the next video and take care.